Hi, I'm Dr. Duke. This is Mindy. She's a local runner, and she suffered an Achilles tendon injury a little while ago. It started off as tendonitis, and then it turned into tendinosis, and that's scar tissue adhesions. And I'm going to show you how we at Duke Chiropractic heal these injuries with permanent solutions. So first, you can't just treat the Achilles tendon. You have to mobilize the entire joint. So I'll come in and I'll do some mobilization over the calcaneus, over the talus. She's a runner. We have to get impact and the ability to bounce. Then I'll mobilize the foot because there's a cuboid, or a little bone on the outside, that keeps that outer arch elevated. And then I have to mobilize something called a cuneiform. And the cuneiform is what allows like push off with the big toe. If you don't have push off with the big toe, you end up having other issues that go all the way up the kinetic chain. Then we'll try a little axial distraction, just kind of open up the joint a little bit more. Lie on your stomach for me. We don't just use EPAT, we use all these modalities at the same time. We feel like that's what accelerates the healing process. So first I'll start with a little Graston instrument, or a large one, and we'll go over the calf and the posterior compartment, all the tendons that run underneath the calf that actually flex and extend the toes. And then I'll apply a little pressure just on the lateral and medial side of the Achilles tendon. You can see how it's starting to turn a little bit red. That's because we're superficially breaking up the scar tissue in that area. Of course, my treatments are much longer than what I'm showing. Then I'll take other patented instruments that are different in shapes and sizes, and then I'll really localize just where I feel the adhesion. And with her, again, I could feel it right on that inner edge. Usually it's the inner part of the Achilles that gets strained because of the way the foot falls and hits the ground and causes an inner pressure to that Achilles tendon. So after we do a bunch of heat, maybe some ultrasound, maybe some electrical stim, Graston, active release, now I know exactly where I want to apply the EPAT, because the EPAT is a radial shockwave therapy that will deliver pressure waves much deeper than what our hands can go. And it will burst scar tissue, and it will create new blood vessels to form, and then collagen starts to seep into the tissues, and it generates a nice elastic muscle and tendon again. So I have it set perfectly for Mindy right now. I'm going to start on the outer Achilles. So with the EPAT session, it delivers about 15 impulses per second. On average, we deliver to the tissue around 6,000 impulses per second. Like I said before, it goes much deeper than what my hands can get. But now that I've found the exact area of where I want to focus, I can then apply the EPAT specifically where I want it. And like an artist, start reshaping the area. I'm Dr. Duke. Make sure you watch our other videos so you can learn how to treat other injuries using EPAT and other modalities.